Good morning. Welcome to the weekly COVID-19 media briefing. I'm Kerri, Schuette, a spokesperson for the Shasta County Health and Human Services Agency. I'm going to start out like we always do with our daily numbers. As of yesterday, we had 255 confirmed cases, including 5 from yesterday. We've done 19,468 total tests, negative tests, I apologize. Our total tests are 19,723. We've got 20 people in isolation who are people who have tested positive and are still in isolation. We've got 133 in quarantine. Those are people who have not tested positive, but are close contacts of people who have tested positive. We have 4 people in the hospital, including 1 in the intensive care unit, and we have had 7 deaths. Today, we are going to do things just a bit differently. As you probably have noticed, we have some new faces today. We've got representatives from some of our local school districts, as well as Judy Flores, our superintendent of schools, who are going to be answering some of the questions that all of you have been asking for the past short while about testing. It's about school. Sorry, I'm hearing some feedback. I don't know. Does somebody
in isolation who are people who have tested positive and are still in isolation. We've got 133 in quarantine. Those are people who have not tested positive but are close contacts of people who have tested positive. We have 4.
There we go. Okay. Thank you. If you could please remember to mute yourselves, it would be much appreciated. Okay, so we are going to spend most of our morning this morning answering questions about schools that we've collected over the past few days. I did want to give an opportunity for our reporters to, if they do have any questions off the top that are not school related, that are related to anything that is not about the schools, please ask those now, and then as soon as those are done, then we're going to dive into the questions about the schools. Does anybody have any questions that are not school related?
Hi, Kerri. It's Anna.
Hi, Anna.
Hey, I just want to know, am I making a buzzing sound or no?
No, it was Damon. I keep muting and it's not working, but go ahead.
Okay, cool. So I do have a question that's not related to schools just yet. This one's actually for County CEO Matt Pontes. So last week, the governor announced $600 million in funds for this project called Project Home Key, which is, kind of modeling after Project Room Key. And I believe today starts the day where local governments and counties can start applying for that. So maybe public health can also answer for that too. Just wanting to know, like, what would the county be applying for these funds to help the homeless population here during the COVID-19 pandemic?
Hey, thanks for the question, Anna. Donnell and I just had a really brief conversation about that topic this morning. And I'm thinking that he can fill you in, but we definitely are aware of it and we have a team looking into it. So Donnell, do you want to add to that?
Sure. Yeah, we're aware of Project Home Key. The funds from Project Home Key, I believe, are $550 million for permanent housing for the homeless who have been temporarily housed through Project Room Key. And there is a $17 million set aside for the smaller counties of the $550 million. So that's the pot that we're eligible to apply for. It is very fast turnaround. And so we are trying to engage some of our local partners and collecting information at this point to see if we can do a project. So we're definitely engaged in that and looking at what we might be able to do.
Can you just elaborate a little bit on that for me, Donnell? When you say fast turnaround, what exactly does that mean?
I don't have the dates in front of me, but I think we have to submit the application by early September, and we have to do the real estate transaction and any improvements by the end of the calendar year. So that's very fast as far as real estate goes.
Since, like you said, it's a fast turnaround, sorry, another follow-up. Do you think because the timeline is so quick that it's possible Shasta County might not see itself getting funds like it did for Project Room Key?
Well, our intention right now is to explore all of our options and do our best to participate. But we do need to have, the stars aligning for us, and so we're going to see what we can do.
And then one more follow-up to that. Do you remember how much the county got for, at least for Project Room Key at the time?
I do recall we got $309,000 and which we can leverage to draw down more federal resource. So we've been using those funds. I believe those funds are about expended now, and we're looking into how we can claim for that to get the federal portion.
Sorry, I just want to get this question out there before we start jumping into the school portion. But with this, money now available to help the homeless population, do you see this at least creating more social distancing? Instead of putting them in temporary housing, it would be putting them in a more permanent environment?
Well, Project Room Key has been very helpful. We've been able to use it for several purposes. One, to isolate and quarantine homeless individuals who either were cases or exposed to cases. We also have been using it to house the homeless individuals who are at higher risk for COVID-19. And our goal is for that last group is to try not to send them back to the street, because these people are elderly and or have a chronic underlying medical condition. And so we're doing our best to try to find permanent places for them to live. And so that's our goal, is try to find housing for those people. So if we do a Project Home Key project, that's what the intention would be.
Great, thank you guys so much. Really appreciate it. I think that covers it for me for Project Home Key.
All right, great. Thank you, Anna. Any other questions that are not related to the schools?
Yes. Sorry, you
go ahead.
Yeah. Sorry,
okay, Steve Gibson.
Questions on behalf of Damon Arthur because of his technical difficulties. So I'm just asking these questions as if I'm him. So his first question is, if there are 107.3 cases in the Anderson-Cottonwood area, how are there that many cases when there aren't 100,000 residents living in that area? That is what Damon Arthur's first question is.
Okay, Damon, so that is a rate, and that's not a number of cases. That's the number of cases per 100,000 people in that community. So the case number is not that high. It's a rate, which is like a percentage. Okay.
Okay, so now his second question: why does Anderson Cottonwood area have a higher rate than the Reading area?
Can I throw that your way from tapping into your data?
Yeah, absolutely. And just to follow up on the last question, when we give case information, that's interesting from the point of view of knowing kind of what's happening on a day-to-day basis, but it doesn't give us a good measurement of risk of disease. And so that's why we have used those rates on that map. Rates control for the population. So when you're comparing Anderson and Reading, we know that Reading has 9 times more people than Anderson. So instead of you having to look at the cases and do some math, we calculate a rate, which is the number of cases per 100,000 in this case population, and that just is a way to standardize the rate. So the number itself, it may not look like it's meaningful, but the idea is to be able to compare then those geographic areas to see where the greatest risk is. And so you've properly asked the second question, which is you've noticed that the highest rate in the county is that southern part of the county. The rate in City of Shasta Lake is similar. The rate in Reading is intermediate, and then the rate in the rural areas of the county is the lowest. And I think the main explanation for that, and Dr. Ramstrom may want to comment as well, is the denser the population, the more crowded the housing, the more likely you're going to see transmission. And we've seen this around the state and other places as well. In some of the communities that are a bit lower income, where people may have more individuals living in the household, there is more household transmission and more cases. So that could be part of what's going on there. But with the smaller numbers that we have, you also could have a large number of cases associated with one particular event, and that could skew the rate also. So I think the numbers are fairly small still, so I think it's probably not appropriate to make huge generalizations, but I do believe the rates, if you look at the map, do reflect kind of the density of the population, and that's probably the main reason. But again, there might be some outlier situations.
Okay.
We're going to actually jump into our schools questions. And if we have time after that, we're already at 11:15. I want to make sure that we've got a lot of questions. People have been waiting a while to get some of these answers to the school questions. So if we do go past time, I'd be happy to stay on with the reporters and answer any additional questions that you might have. But I'd like to jump into the schools right now, if that's okay with everyone. So I wanted to introduce, as you already know, we've got Karen Ramstrom and Donnell Ewert and Matt Pontus from the county. We've also got Robert Folden from Mercy and Mark Mitchelson from Shasta Regional. And then from the schools, we've got Judy Flores. She's our Shasta County Superintendent of Schools. Heather Armelino is the Associate Superintendent for the Enterprise Elementary School District. And Jim Cloney is the Superintendent of the Shasta Union High School District. Those two districts represent a pretty significant percentage of our local student population. So they are here to address some of the questions that folks have brought forward. I wanted to start by giving Dr. Ramstrom an opportunity to just speak briefly about the state guidance regarding schools, and then we can dive into some of these questions.
Thanks, Kerri. Good morning, everybody. So I thought I would just a quick overview of the state guidance that came out from the California Department of Public Health late last week. And this updated the requirements for health and safety essentially within schools. And there were a couple documents that came out, industry guidance, as well as some supplemental information to help inform whether schools can open based on how transmission and healthcare system capacity and other indicators are going in those communities, and some preliminary information to build on as far as if there's cases in schools. So as far as opening of schools, so the state is connecting those decisions to the county monitoring list that I think all of us are familiar with now, because a week ago Monday, the governor announced some additional statewide closings and supplemental closings for counties that are on the county monitoring list. And those, there's a link to that on shastaready.org if you're interested to see what those indicators are. We've talked about that before on this call. So if counties are off of the county monitoring list for 14 days, schools may open in person for in-person instruction in those counties. And if a county is on the county monitoring list, then they have to be off the list for 14 days in order to open to in-person instruction. So that means that distance learning is happening in some counties, in some circumstances, if hybrid models are in place. And so the legislature and governors signed off on SB 98 that actually gives some parameters around that. And I know that the schools have been, and school leadership has been working really hard over the summer to meet those requirements in terms of access to devices and connectivity, you know, how it would work to have teachers interacting with students on a regular basis and students being able to interact from their homes. And then adaptations that are required for English language learners and special education students. In addition, there's a number of prevention measures that are outlined. Again, schools have been working really, really hard to prepare, and those include things like symptoms checks for children when they come into school. The face covering requirements were updated, and so now there's a requirement for students that are in the 3rd grade and higher to wear a face covering at school. It is encouraged for those in the 2nd grade and younger, but not required. In terms of physical distancing, teachers and other adult staff need to be 6 feet from students in the classroom, the way they position their setup. And it's encouraged to maximize distance between students within classrooms and figure out ways to situate them so they have less face-to-face interaction and close interaction. And the key, especially for the younger kids, is what's called cohorting. So you have the same groups of children that are together throughout the day with the same dedicated teacher as much as possible. And they're having lunch and recess and all of those activities together so that you're limiting the number of other individuals that they're exposed to. Of course, hand washing and cleaning and disinfection practices are in there. And then there's requirements for having a plan should a child develop symptoms, how that child would be isolated in a separate room until they can go home and be cared for. And then lastly, when might a school close once the school year begins? And so we'll be having those conversations over the next few days with Judy and the superintendents, what that would look like. But the state did out some parameters, which I think are going to be really helpful, some metrics that can be used to do that, to make those decisions. And so I think that's all I had. So I think we can dive into the questions, Kerri.
Great, thank you, Dr. Ramstrom. Judy, did you want to add anything before we hop in?
Sure. I think there's often I just wanted to clarify the county office role in all of this. Certainly, we don't approve school plans or school district plans, but we've really seen our role over the course of the last, really since March, to help bring understanding and bring people together. So setting up opportunities for Dr. Ramstrom and others from public health to be in communication with our charter schools and school districts, helping to assist our schools and districts in really understanding the guidance and then developing resources that will help them as they make decisions. And so it really is a role more of support than it is approval. And so I think there's often a misconception there. And so I thought that was important to clarify right out the gate. So I did ask Jim Cloney and Heather to join us because they do represent our two largest districts in Shasta County. And between the two of them, we have well, it's well over a third of the students in the county. So Kerri, I'll turn it back over to you.
Okay, awesome. Thank you. So just so everyone understands the process, we collected there were many questions, more questions than we could possibly answer in this small period of time. So we took those questions, aggregated them, came up with mostly the common themes and the ones that seemed like they affected the most students. If there are questions that are still unanswered, we would be happy to do our best to try and look into getting those answers and posting those answers on our FAQ page. So starting with, how will social distancing be observed inside the classroom? Oh, we can't hear you, Jim. Do you have your phone muted? It worked when we tested, yeah.
Well, I can jump in on that one. Our mantra is about maximizing space and minimizing contact between students. So we're looking at the configuration of our rooms to see how we can spread out students as much as possible. And then, of course, with the mask requirement in upper grades, that helps us because those classes tend to have more students in them as well. And then making sure that our teachers' desks are 6 feet away from student desks and that sort of thing.
Okay, great, thank you. Will teachers be expected to stay 6 feet away from students in special needs classrooms?
That isn't always going to be practical in any of our classrooms. There are times when we will be closer to students because they may have different needs. And so the fact that our staff are in masks as well is a safeguard there. And then as much as we're able to, we'll keep that distance in place.
Can you hear me? Am I back? Yes? Okay.
Yes,
sorry.
Thank you. There you are.
Redial in, sorry. I don't know what happened there. And I apologize,
That's
I did not hear Heather's answer because I was busy trying to dial back in. So I'll maybe repeat a couple of things real quickly, but if the question is how will social distancing be observed, clearly as best we're able. We're using that guidelines that we've got from the Regional Association of Northern California Health Officers, and they're looking at them, 6 feet is ideal, but a minimum of 3. So those are the numbers we're trying to work with. And if necessary, we're going to work on class sizes to make those more viable.
Thank you. Will after-school programs still be available? And if so, will students from different classes be mixed together? And I think the genesis of that was we were talking about cohorts and how kids are going to be in separate classes, but an after-school program might make that a little bit trickier.
Yeah, so the Shasta County Office of Education operates after-school programs in all of the smaller districts, and so I think we have well over 20 programs, and we've been in conversation about this. We will do our best to create a cohort for after-school. It won't be the same cohort as during the day because not all students stay for after-school, but part of what we're looking at is family groups staying together in the same cohort, and then keeping that cohort, once it's established, together as they move through their time in after school. And so it really will create a different after school program than maybe what they've seen before, but we're, again, trying to minimize contact as much as possible.
Thank you. This one is for Dr. Ramstrom. Why is it safe for our children to go back to school, and yet it is still discouraged for people to gather outside their house?
Sure. So we worry less about transmission between children than we do between adults. So studies worldwide have shown that, especially for younger children, child-to-child passing of this virus is much less likely to happen than adult to adult. And it's sort of on a gradient. And so as kids get older, the likelihood of transmission between children goes up. And so that's why the encouragement of masking in the younger groups, but then the requirement as children are getting older. As far as how is it different than people outside of their households, I would say number one is that there's a lot of other prevention practices that I just outlined that are incorporated into the way the schools are going to be operating. And so it's a more of a controlled setting than outside the household. So I think that that's the main thing. When you're outside your household, you really don't have control or knowledge about those other individuals, about where they've been, and might be harder to control your distance between each other and the mask use.
All right, thank you. Will school districts hold public meetings for parents to express concerns and get answers to questions regarding new school policies and procedures?
So I can say obviously the irony of the question is we're not having public gatherings, so it's hard to say we're going to have a large public meeting. We did do our July board meeting as a in-person socially distanced meeting with our board, and all were in mass who attended, and then it was live streamed. So we did take some feedback and comments via email. We've done a parent survey earlier before school dismissed, and we've been taking comments throughout the summer. So I would encourage individual parents with individual comments and questions to contact the local school district administrator. But I don't know at this point in the summer, with basically about 2.5 weeks left, that we're able to do that.
All right, thank you. Will masks be provided by the schools or by parents? And what about families who can't afford to buy masks?
So I'll jump in with this one to start with. The California Office of Emergency Services has partnered with the California Department of Public Health to have PPE, including masks, sent to each county office across the state for the start of the school year. And the California Department of Public Health guidance clarifies that the schools will need to provide masks. So the masks that are coming and actually are being picked up by schools this week, we opened up for distribution on Monday, includes masks. It also includes some shields for teachers in place of masks. It also includes a variety of other pieces. But the idea was never that would be enough to account for the whole school year. It's just enough to get the school year started. And statewide, there is a back order on masks for young children. the cloth mask. We have the disposable mask, but not the cloth mask. And so that's a that is not yet available, at least from what we've received so far.
Okay, thank you. This might be for Dr. Ramstrom. Will face shields be considered as a mask alternative? Can parents choose to keep their child from wearing a mask, and will medical exemptions be allowed? I'm not sure who's best for that.
Well, we actually had a meeting with Dr. Ramstrom yesterday and began to talk through the updated guidance that had come out on Friday of last week. So in terms of an exemption, there will be a medical exemption allowed for students with asthma if they have a doctor's note. And there may be some other conditions, a mental health condition or disability that might prevent them from wearing a mask, or for anyone for whom a mask could obstruct their ability to breathe. The other category that is exempt are those who are hearing impaired or communicating with a person who is hearing impaired, so when it's really important to see the mouth for communication. And really the only exceptions during the day will be when students are eating and when they are outside and more than 6 feet apart.
All right, thank you. Will distance learning be an option, or will parents need to homeschool if they opt to not send a child to the physical campus?
Maybe I'll take that one. So just maybe it's a semantic issue, but distance learning and homeschool really depends on how you're looking at it. So for instance, in our different plans, we don't specifically reference distance learning from the school side, but we do have a strong independent study program. So for instance, a parent who chose not to send her back to school in either for us, a phase 3, which is a return with PPE and social distancing, or even a hybrid where they're coming part of the week, but not the whole week. If those two scenarios are still not workable, we do offer a full independent study program. So it requires minimum face-to-face time, a lot of online instruction, and instruction in the home. So I think the terms sometimes are confused or should be maybe used interchangeably, distance learning and independent study. But the way we're interpreting that, distance learning is independent study. And we will definitely offer that option to any of our students who prefer it or families who need it.
Great,
And
thank you.
to build on what
you
shared, every school district in Shasta County did surveys of their parents to find out how many were looking to have remote learning this fall. And to my knowledge, every one of them is offering some sort of independent study program to accommodate parents who want to keep their students at home this year.
All right, thank you. Heather, did you have anything to add for the younger kiddos? Is it the same with you, with your group?
Yeah, pretty much the same. We'll offer and support families who want to keep their kids at home and provide that instruction remotely.
Okay, great, thank you. Can teachers with high-risk family members teach from a distance?
I mean, that's really going to be a case-by-case scenario is what I would say. I mean, that's obviously something our human resources folks are going to engage with our staff members who have concerns about their individual assignment, whether it be teaching or some of our custodial crew or bus drivers or any of our folks. So it really is just going to boil down to an individual conversation with those folks.
Great, thank you very much. Will parents be expected to sign liability paperwork that protects the district if a child or family member contracts COVID at school?
We haven't had any of those discussions. I can tell you that. I don't know, Heather or Judy, if you have an input on that, but I don't know of anyone having those discussions that I'm aware of.
All right, thank you. We had a couple variations of this question with in terms of attendance. I know that people are being encouraged to keep their kids home when they're sick, even when they're mildly ill, and that is historically is problematic. So will parents will parents get in trouble for keeping their child home too long when they are sick?
And again, speaking from my own district's perspective, I would imagine we would be looking at those in a much more relaxed way going into the school year. You know, I think everyone realizes the situation has been and continues to be pretty fluid. Where we are today and where we'll be in a week or a month is anyone's guess still. So I would imagine day-to-day attendance is going to be treated a little differently maybe than it has in the past.
Okay, great. Thank you. Okay, so Dr. Ramstrom, I'm going to jump down to, will all parents and staff be notified if there's a positive case in a school?
So in the guidance from the state, they do talk about communication, and in the draft documents that we'll be talking about in conjunction with SCOE and the superintendents in the next week or two, there is information and recommendations in there in terms of communication, and this is one of the circumstances. So certainly there would be communication with the family involved, but then also the classroom and generally to that school community so that they know what's going on. And just add in a confidential manner, but to let inform the families what's happening and what they need to be aware of.
Okay, great, thank you. How often will school buses be cleaned?
So again, Heather or Judy, please jump in, but I'll just keep talking, I guess. So our protocols regarding homeschool transportation include a couple of different things. One of which is all students who ride the bus will be in a face covering. The second would be that we will have 6 feet of distance between the driver and students. And then the third main component is that after each trip, the bus will be cleaned. So for instance, in the morning, make the route, pick up the 30 to 40 students, drop the students off at school. Then that bus would be cleaned before it was again used to pick up more students, if that makes sense.
Absolutely.
So I guess the short answer is multiple times per day, potentially.
A lot. Okay, sounds good. We already talked about that. Okay, so I think you partially answered this, Dr. Ramstrom, but the guidelines state masks will not be required for 2nd grade and under, but many schools go up to 5th grade. How effective are masks if only half the students are wearing them?
Right, so the age requirements or grade requirements for the mask use was done intentionally based on what I described earlier as far as risk of transmission. And I will just say that, you know, even if it's not 100%, because we have these children that have underlying health conditions or are hearing impaired, what have you, that there still is benefit, even if you're not at 100%. And so that goes, you know, in the school, it goes in our community, it goes, you know, it applies if you're in the grocery store and only, you know, 75% of the people are wearing masks. Well, that's better than not having that happen. So, yeah, I don't think I have anything else to add to that.
Thank you. We're into the home stretch. Will meals still be provided to students who continue with distance learning?
Yeah, I can take that. Absolutely. We got real creative once school closed, in some cases using our buses to deliver meals. So it could be happening in a variety of ways. If we were, for instance, in a hybrid, it might be that students take home food for the following day if they're going to be home the next day, or we make our kitchens available for pickup or even delivering through the bus.
Thank you.
Yeah, I would say the same for our district. I think that's probably true of most districts in Shasta County. As long as the student stays enrolled in some way, shape, or form, whether it's distance learning, independent study, traditional, then we're definitely part of our meal program.
Okay. Great, thank you. What will a normal day look like? Will playgrounds be open? Will kids eat in the cafeteria? Will PE take place? And are class sizes being reduced?
You want to go elementary, Heather, or do you want to go high school first?
Sure. And you may have to remind me of the pieces I left out, but The biggest changes are that not only with the face masks, but keeping students in the same group throughout the day with the same teacher. So that's going to change the way recess and lunch look, but it doesn't mean they won't get to do those things. So when students go out to recess, they will go out by class. They may be rotating turns each day as to who gets to play on certain playground equipment, but they will get out to be able to play and to do PE. We will limit what kind of equipment we use, and we'll limit it to the use within a cohort so that it can be cleaned. And then it may not be the same at every site, but we will make use of our cafeterias. We're just staggering classes over a longer period of time so that we aren't cramming several grade levels in there at one time. So it's going to take a little bit longer, but we can get through those things with our groups intact.
All right. Jim?
So, and from the high school perspective, of course, cohorting is a much more difficult chore just because of the nature of high schools and the way high schools typically work in terms of a departmentalized program where kids have 6 different classes, 6 different teachers. So I guess my answer to the question really depends, and it goes back to our reopening plan, which is not unique to us, and I'm sure Enterprise Elementaries will have different phases, and so it really depends on where we are. If we were in what we would consider phase 4, which is basically return to normal, then there wouldn't be the changes. Phase 3, which is a basically return with full face coverings, lots of social distancing and PPE, we will look at class size mainly from a standpoint of how many students can we safely socially distance based on those numbers of 3 to 6 feet. So we have to reduce some class sizes accordingly. Our cafeterias, we're looking at half capacity or less, encouraging kids to eat outside, to socially distance. PE is another ongoing discussion, whether or not we're going to allow the use of locker rooms and how we do PE activities. So if we go to a no dress PE, in other words, students just wear their typical school clothes, and the activities they do may differ. So we're working on those issues. So it really just depends. If we're in a hybrid, which we're calling phase 2, it's basically with half the students on campus. So obviously the social distancing measures are easier to attain because we have half the students. So those two are fairly mirrored, except for just the number of kids change. And then if we're in phase 1, which is the return to, distance learning for all students, well, then a lot of these issues don't apply because students aren't attending campus. So it really depends on where we fit. And our decision on those issues, and this is where we work with Dr. Ramstrom directly and the folks at Public Health, is just local conditions and what it looks like for us.
All right, thank you. Here's Ethan's question. What will happen with fall sports? Will kids be allowed to play and will parents be allowed to watch?
Guess I'll take this one. It's probably largely a high school issue. So maybe give a little context to make sure everybody's on sort of the same page. So the CIF, the California Interscholastic Federation, made their announcements as far as high school athletics goes. And what they've done essentially is to push back into the spring. They've taken all high school athletics and developed a playoff schedule that really would have sports starting sometime in January. The northern section, which is the section our high schools belong to, and there's 10 sections in the state, had a meeting, discussed that guidance, and decided that it would be up to the leagues to approach their local public health directors on what they felt they could do inside their county in terms of local conditions. So for our district, which is Shasta Union, we belong to the EAL, and that's the Eastern Athletic League. It involves schools in Butte County, Chico and PD. It involves schools in Tehama County, Red Bluff High, and of course our 3 high schools here in Shasta County. We have a meeting scheduled as a league to talk about our options. The first one being, what do we think we can really offer to our students? And then how can we go about trying to get approval from our local public health? I will tell you, I think everyone recognizes the team sports are a very, very heavy lift and realistically not really an option based on the guidance that came out on July 17th, where they specifically talk about that, I think. And then also, and I believe this is happening sort of in real time, but my understanding is Butte County is on the watch list now. as of the last hour. So that obviously is going to change the conversation for Chico and Pleasant Valley High School. So I would say, to answer as best I can, we'll still meet as a league. We'll still discuss our options. And I think our primary focus will be on the individual sports. And this is under the presumption our schools, obviously our primary focus is keeping our schools open. But if we're able to keep our schools open, are we also able to offer some of those extracurriculars such as athletics in a limited way and primarily individually? But again, that's all really dependent upon ongoing dialogue with our local public health office, and we're certainly not going to do things that don't fit within their guidance.
All right. Thank you, Jim.
Right, and Kerri, I can just add too that we as health officers and public health have been in conversations with the state and asking about this for the last several weeks. And there's actually a call this afternoon. We anticipate there's going to be either guidance or at least a FAQ coming out from the state in the next couple of days. So we'll have more information then. You know, what I know is really kind of what Jim described, with the exception that even at the local level, we will be limited to doing what the state allows. We can't do more than that. We can be more restrictive, but we can't be less. But it may give us some parameters that we can have our own local conversations around. So we're gonna have to see what it says when it comes out.
Thank you, Karen, for that clarification. Will regular testing be done on teachers and students? If so, how often and who will be chosen?
For us, I think my short answer. I don't know, Karen, if you want to comment on that, I'd let you.
Go for it, Jim. No, I can answer that. So it is in the state guidance, and ideally will we be doing surveillance of our teachers on a regular basis because as they're kind of in that critical infrastructure workforce as our healthcare workforce and others that have direct contact with the public on a regular basis. So we're going to have to figure out what's feasible. I think everybody is aware that we are not in the optimum place in terms of testing capacity. We've been doing a lot of work through our Emergency Operations Center and now our Department Operations Center to address that capacity countywide. There are a lot of school staff, and so we're going to have to strategize on that and figure out the best options. It may be that we have kind of a baseline recommended frequency, and then if we were to have cases in the school, then we might want to bump that up. But that is yet to be determined exactly what that will look like. The surveillance testing does not apply to the students, it applies to the school staff.
All right, thank you. I know we need to get out of here. We've just got a couple more quick questions. Internet connections for families who can't afford it and opt to do distance learning. Is there an option for that?
You know, Judy or Heather may be more up to date on this than I am. I know we had some options when we first went into distance learning back in March and April and carried through the spring. And I know our folks in our IT department were working on those in terms of providing hotspots and things like that. So I think we would certainly try and be as creative as we can with that and just work with those families individually.
One of the things we worked on over the early part of the summer was looking at family units. And, you know, with so many K-8 districts in the county and separate high school district, you know, where are those family units that could take advantage of a hotspot and not distribute multiple ones if the kids were in different schools? And so that's one of the things I know IT directors from across the county are working on.
Right. Not on our list, but one that popped back into my mind was private schools. Private schools, are they also governed by this, by the state guide?
So it's interesting because, you know, typically when we have done work, we focused on the charter schools and our school districts. And so very early on in the whole, back in March, I reached out to all of the private schools and invited them to jump on board so that they could be getting the regular updates and information. And I know that many have reached out to public health and our contacts at Public Health with their plans. And so they're very much on board. They want to do what's right by the students that they serve and the families that they serve. And so, yeah, they've been very much a part of the meetings that we've been holding and the updates.
All right, and last but not least, I loved this question, and I hope it speaks to the heart of what all of you are doing. What can parents do to be supportive of our students, teachers, and schools over this next very challenging school year?
Well, I think
I'll go first. Go ahead, Heather.
I think the first thing that comes to mind is the issue of having to wear a mask at school. And so for parents to help reassure their students as to why we're doing this, and to look at it as a way we're helping each other. We're helping to protect our teachers and our families at home, and to give them the opportunity to practice that at home and have fun with it and find a mask that is comfortable and might be fun, and then just to practice so that they're ready when they come back to school. It doesn't feel so strange, and we set the tone for kids as to how they will largely feel about this whole process. And so the more we can reassure them that it's okay and it's not going to be forever. The other part of that, I would say, is also with hand washing and just establishing good routines and how to do that properly and how often to be doing that. Those two things would be a tremendous help as kids return to school.
Yeah, I would certainly say that for sure, because I will say that, when our board and our reopening committee made these difficult decisions about how we wanted to go about this process, it was really done through the lens of what we feel is most important is getting back to 5 days. And if there's a way that we can find a path back to all students with 5 days of instruction, then we really need to work to find that path. And that's why we, sort of developed our phase idea. And it is really dependent upon face coverings to get kids back in school. And I'll say I don't like wearing a mask any more than anyone else does, but I do believe that if that's what it takes to get our students back in for 5 days of instruction, I think that's a sacrifice we should be willing to make. And I'm saying that to our staff, our students, our families. I just think that that's where we have to start. And I would say the other thing that we can all do is just understand and just have patience that this is a fluid situation, and it will change because we've seen it change. Hopefully it will change for the better. If it changes for the worse, then we'll adjust accordingly. But it is going to be a fluid situation. We encourage everyone to have patience and flexibility, and just understand that we are absolutely doing the best we can to serve the students that we are here to serve.
Yeah, and I'd just like to chime in. I had the same thought as Jim in terms of patience and flexibility, and that, parents are a key partner in making this successful. And I would just say that I think one of the most important things, and I know this can be difficult, is if your child is sick, keeping them home, because it's just going to cause a lot of complications at the school. And we don't know, we may not know what is causing that child to be sick. And so that would be the ask, is to really try and do your best to comply with that. Keep your child home if you're sick. The other thing I would add is that I think most of us have been concerned with, we've actually seen the number of kids who are on our case list, the number of children in recent weeks. And I would say that a lot of that comes about from exposure from their family members or families traveling together. And so that's something else to keep in mind, is that what you do actually can expose your children, and then they would be coming to school with whatever they've been exposed to. So just keeping that in mind when you're planning your activities. We're continuing to recommend that you not mix much with people that are outside of your household, and just recognizing that the risk that brings to your family and your children, and then potentially to the school.
Certainly, I'm in agreement with everything that's been shared. I would say that one other thing I've heard from Dr. Ramstrom that has rung true is the importance of getting the flu shot. so that we can really differentiate between what is the flu and what is not, so that it doesn't impact our testing as greatly. And so just being mindful as soon as those flu shots are available this fall to be able to take advantage of those, so that we're not overwhelming our system without needing to, if it really is the flu as opposed to COVID.
All right, thank you very much. We are right up against the noon hour, and that has become a new normal in the world of everyone on this panel is noon meetings. So we are going to need to say goodbye to all of you right now. If any of our media representatives have questions, you guys know how to reach out to me. You can call the media line, email me, text me, call me, whatever you need to do, and I'd be happy to track down the answers to you if I don't have them myself. Thank you so much to our school partners for being here with us today. I hope it's been helpful to some of our families to kind of ease everyone's mind about what things are going to look like. We appreciate your participation and everyone's patience with this ongoing situation. Thank you again very much. Please stay safe and healthy, and we will see you all again next week, 11 a.m. on Wednesday. Have a great day, everyone.